It's very easy to explain to people how important their hearing is, particularly to those who are suffering with various levels of hearing loss. My introduction to cochlear implantation was as a resident at Portsmouth Naval Medical Center, where the program was developed within the Navy while I was there. The ability for a grandparent to hear their grandkid tell them something as simple as happy birthday was a stunning event for many of these patients. And it's a very, very rewarding experience for a physician. Now, patients who get a cochlear implant are very hard of hearing, whether they're adult or a child. And a cochlear implant does not give you normal hearing. It restores a great deal of information about sound that with training becomes functional. In other words, you can understand speech. You can understand what's spoken on the television or radio or telephone. A cochlear implant works through the application of electrical current to the inner ear itself. Now, the inner ear is designed a lot like the keyboard of a piano. At one end you have the low, at one end you have the high frequencies. And just as you can play the keys of a piano to produce notes, you have to play the cochlear in a similar way to produce sound. And of course, in language, those sounds have to be very carefully arranged in order for them to be understandable. Now, when a patient first hears sounds, everybody sounds like Donald Duck. Well, of course, we don't sound like Donald Duck in reality, but the patient over time, through a combination of both practice, listening, and also through the careful reprogramming of the cochlear implant over the first several months, learns to convert that Donald Duck-like sound into words, and then into comprehensive sentences, and then into a more full meaning of what the conversation's about. Adults are a very different population to serve. One, the majority have learned language, and they are reliant on language, and they often want to return to a society of words and sound. But the difference with an adult is that they've already learned language, and in many respects it's much, much easier for them because they know the language already. In some respects it's much more difficult for them because they don't remember language sounding the way it will with a cochlear implant. And so it's different challenges for an adult or a child. A child born deaf implanted will know nothing but the sound produced by a cochlear implant. An adult who's become deaf will remember language from before, and they offer very unique challenges for those who want to help these individuals communicate.